Ensure that the scene is safe and that the correct BSI is being used. The EMT will then instruct their partner to stabilize the patient's C-spine, which will prevent any movement of the head and neck. Next, check CSMs. Start by checking for the presence of a radial pulse. The patient should then identify which finger is being squeezed and wiggle all fingers. Do the same for both feet, using the pedal pulse, again having the patient identify and wiggle their toes. The next step is the application of the C-collar. First, it must be measured to the patient's dimensions. The length of the neck is measured using the width of the EMT's fingers, from the jaw to the base of the neck. This patient's neck measures 3 fingers. The fingers are held against the C-collar in line with the bottom of the blue plastic. The hole which the last finger is covering is the correct length. Pop the locking mechanisms out and adjust the collar to the correct length. Then lock it into place, and the collar is ready to be applied. It is important to avoid any large movements of the patient's spine during the application of the C-collar. With a partner continuing to maintain stabilization of the C-spine, the collar should be inserted under the neck and shoulders. The collar is then curved around the chin and fastened with the strap. To ensure the device remains secure, a rubbing motion should be used over the Velcro. The partner must continue holding the C-spine after the C-collar is placed. Now that the patient is partially immobilized, the board must be prepared. The head pad of the longboard is secured using 3 straps. The top strap is inserted through the circular hole at the top of the board to prevent the pad from sliding. Next, the 2 side straps are brought under and around the board and fastened onto the Velcro. Note that the straps are placed straight across and not through any loops. Now that the head pad is secured, the patient can be transferred onto the longboard via log roll. A log roll must be performed on the head person's count to continue maintaining C-spine. On 3, the patient is rolled and the longboard is placed against the back. On the head person's count, the patient is rolled back onto the board. If a patient must be readjusted, it should be done on the head person's count and in a vertical motion. Ensure that the slots are aligned with the patient's shins, thighs, hips, and armpits. With the patient in a proper position, the chest strap can be applied. The goal is to place the strap high on the chest near the armpits. The buckle is inserted under the first slot upside down and fed across the chest. It is inserted under the second slot, and the extra slack is pulled through. The buckle should be placed off to the side of the chest to allow for access if CPR is performed. Padding is inserted under the buckle and the strap is tightened. It is important to make sure that the chest strap does not deform the C-collar. The next strap will be placed at the patient's hips. First, feel for the patient's hip bones. The strap must avoid sitting across soft tissue, particularly up towards the abdomen. Secure the straps in place using the same procedure as before, ensuring the buckle is padded and lays to the side of the patient's hips. The third strap will be placed above the knees, and it is important to avoid the kneecaps during the application. The buckle can be placed in between the legs and must still be padded. The final strap will be placed around the shins below the knees. The position of the straps at this stage matters more than their maximum tightness, which will be achieved in the next step using a second technique. It is important to avoid ever stepping over the patient as the straps are being secured. Now, the feed and pull method will be used to allow the EMT to smoothly tighten the remaining slack and completely immobilize the patient. Notice how the strap is being pulled in line with the buckle. This prevents friction from interfering with the tightening. The remaining strap can then be tucked away on the patient's body. The slack from one side is fed through the buckle with one hand, while the other pulls the strap tighter. As a result, the strap will be visibly taut. After the patient's body is well secured, the head is next. While the partner continues to hold the C-spine, the head block should be applied to the Velcro on the head pad. As the blocks are brought together, the partner should spider their fingers to the outside and continue to stabilize the patient's head. 2 straps are used to fasten the blocks in place. The first one placed under the chin and through the second loop on the head pad. The second one should be placed across the forehead. These straps must be tight enough to prevent any movement of the head. Now that the patient is fully secured to the longboard, the partner may release hold of the C-spine. The final step is to recheck CSMs to ensure that the action of strapping the patient to the board did not accidentally cause a loss of blood flow or other injury. The patient will remain on the longboard during transport to the hospital.